Good afternoon, everyone. So, my name is Komal Wagh, and I'm very happy to give a brief introduction about my company and what work my company does. So, I'm from Konica Minolta Healthcare India. So, a brief introduction about my company is this is a Japanese company. Okay, our headquarters is in the lively city of Tokyo, and we have 150 offices in around 150 countries. Also, I would like to share that this company is in this region for around 150 years, and this year we completed our 150 years. So, Konica Minolta Healthcare India is the subsidiary of Konica Minolta Japan, and our vision is to be a trusted and ubiquitous medical provider. So, basically, we are dealing in the healthcare segment, and these are the variety of products that we are offering. So we are into the computer radiography, digital radiography, and ultrasound imaging. Apart from that, my company has come up with digital solutions as well. And we have a very novel technology which we did not have in India till now. So I would be showing you more about that. It is the X-ray that moves, or you can call as a dynamic digital radiography. So to summarize, this is my entire product portfolio. So I have the ultrasound systems, we have the DR panels, CR, and we have a smart eye digital solutions. We have printers as well, and this is our new technology that is for the DDR. So this is my entire product portfolio. So shortly, I will just tell you about a very intelligent solution that I have for your patient management and for your patient images and reporting. That is the Smart Eye. So Smart Eye is an image reporting and sharing solution. So what it does a patient registration. We can do the patient reporting. We can do the storage and backup of all your patient data, as well as this image and reporting can be done via an app. So like you receive some Facebook or Instagram notification, similarly, you can get all your patient details within like a notification. Also, this is a very great tool if you are doing some business because it gives you all the business analytics. So one can have a note of a commercialization of their modality which they are using more, or from which center they are getting more patients. That all business analytics this system can perform. So this is a very pictorial information how that system works. So whenever a patient comes in any clinic or hospital, the image will be acquired by the modality and then sent to a Smart Eye workstation. And then this workstation uploads everything on a cloud. So this is a very intelligent system wherein all the data can be accessible in any corner of the world. So this is very different from your PACS, because in PACS, you can have the data only within that hospital. However, Smart Eye enables us to have the data on the server. So this can be, the data can be given to your patients, to your physicians, or whoever is a referring physician. Now, I want to introduce a very new technology to you, as the theme of this event is innovation. So, I would like to introduce a very path-breaking technology in X-rays. So, this is first time in India, and that is the digital dynamic radiology. So, with this technology, not only we can visualize the motion, but we can evaluate the function also. So how this system works? You might have seen a plain X-ray. However, with this system, we are using a very unique type of pulse generator. So what this pulse generator does, it is very efficient in taking almost 300 images, X-ray images, just within 20 seconds. So this all is happening within 20 seconds, and what you can get is a DDR loop or a data set, which was not possible till now. Also, if you see for this technology, the radiation exposure, if you compare with your CT or fluoro, the radiation exposure is very less. It is only 1.9 milligray. So what are the applications of this DDR? Right now, the possibilities are endless. As this technology is a very novel technology, it is blooming. So currently, we have explored the technology applications from 2018, and we have many applications in pulmonology field, surgery planning, like if your patient is going for some thoracic surgery, and also in the orthopedics field and in the respiratory medicine. So this is how a DDR looks. This is taken for a neck. Similarly, we can have the data sets for your knees, for your wrist. So this is very a topic of interest for orthopedics, wherein just like a simple X-ray, instead of a simple X-ray, you can ask your patient or your clinicians to give you a DDR data set, wherein the motion can be evaluated. So this is the utilization for your pulmonology. So these are a follow-up case. So this patient has undergone a lung surgery, lobectomy, where a part of lung is removed. So with the help of DDR, instead of doing a CT scan for a patient, you can do just a simple DDR, and you can see how the surgery or how the patient is progressing. So if you see the pre-operative loop we have, and then post 1 week, how the patient is progressing. So the patient had some pleural effusion that can be seen, and after 1 month, the patient is progressing well. That can be easily seen. Also, not only the qualitative, we can quantify also, we can measure things in DDR. So this is another graphical representation that I have. It is tracking the motion of the lungs and your diaphragm. So if you see, the blue is my right lung and the green color is my left lung. So if there is any mismatch between the movement of the lungs, even that can be tracked. So the paradoxical motion can be tracked with the help of a DDR. Earlier, we used to send the patients to maybe fluoroscopy or CT. However, with the DDR, it is very convenient. Apart from that, it has many good imaging modes. So I have just listed few of the modes here. So this is the original dynamic image that a doctor will get, and this can be used to localize a tumor or see the tumor very finely. So if you see, I have a bone suppression mode. So suppose the tumor might be getting not visualized because of the bones, so we can have a bone suppression mode on, which will suppress the bones and highlight the tumor. Similarly, I have a field enhancement view also, which will enhance a particular field of interest, and it can give results similar to your CT. So instead of sending your patient in a CT console, you can just simply have the examination for a DDR. So I will just summarize the benefits of DDR. First of all, its clinical value. It has a good clinical value. The field of view is more, 17 by 17. Then if you compare with the modalities like CT and fluoro, it is very low cost. Then it is patient-centric. In CT and fluoroscopy, the exposure is too much. However, in DDR, like I said, 1.9 milligray. So the exposure is less. Then it is efficient because we can have the patient in a supine position as well as on the bed. So we can have different positions for the patient. Also, it is effective. You can visualize as well as quantify the movement. And that's why it is like a very interesting technology. So I would just ask you to join the movement. So thank you for patiently listening to my presentation. I have a very short video which would let you know more about the DDR technology. So we'll have a look at it. Thank you. Volume.
Thank you.